you said that 9 out of 10 cases of lupus affect women. So how does it typically affect their quality of life based on your experience? What are the main challenges they face? And yeah.
So the biggest challenge that patients with lupus face is the delay in diagnosis. The way lupus presents is manifold. It has multiple symptoms, affects multiple organs. So by the time they reach a diagnosis, a good few months and even a few years may have gone before they are diagnosed. So
Right.
if the symptom is involving a particular organ, let's say, involves the joints, then their mobility can get affected. If it involves their skin and causes rashes, then obviously their self-confidence, their personality, those things get affected. And if they have a major organ involvement, which is the kidneys or the heart or the lungs, then there could be a threat to their life. So as a rheumatologist, what we tend to do is see the patient and then classify: do they have a mild disease, do they have a moderate disease, or they have a severe disease, and then go on to offer treatment accordingly.
Right. And you said that uh, it could be mild, it could be moderate, it could be severe. What are some of the symptoms that, first of all, what are the symptoms that they're seen when it's mild? And, when do these symptoms start to affect their lifestyle?
So, because lupus is a chronic condition and it is most of the time insidious in onset, so it may take a few weeks or a few months to show its signs. Most patients initially may have a little bit of a flu-like symptoms where they may have low-grade fever, they may have some arthralgias, joint pains, muscle pains, and progressively over time then develop other things like a rash on the face, which is typically a butterfly-shaped rash on the nose and the cheeks. They may develop some weight loss. They may develop joint pains, swelling in the joints, early morning stiffness, and then if more severe, have high blood pressure, swelling in the legs, and so on. So
Right.
initially, it may be that they are not able to function as well as how they were earlier doing. So they may lag in their school homework or their jobs. They might take more sick days. And as the disease progresses, they then tend to seek help and then get diagnosed either early or late. So definitely the quality of life is affected. And the earlier we diagnose, the earlier we treat them, they are back on track and go back to their usual routine.